Vaccines have been vital in China's fight against the COVID-19. Since the first wave of resurgence in December, China was questioned for the effectiveness of its vaccines. How effective are they, and what's the situation now? I talked to doctors and medical experts for more clinical experiences.
接种疫苗之后呢，我们在某种程度上
No single vaccine will prevent infection at 100%, but vaccination is good at protecting people from critical illness and death caused by COVID-19.
We see reducing effect of vaccines as the new Omicron variant is good at evading immunity.
Their message is simple. COVID vaccines are not magic pills. They were never meant to offer 100% protection from infections, not to guarantee an instant end to the pandemic. But vaccines are very much needed for the global fight against the COVID-19. They help prevent serious illness and death. With the virus' ability to mutate quickly, the WHO has also warned that Omicron is spreading like no other strain that COVID-19 has had before. And that brings more challenges to the vaccine development.
That are very good at escaping immunity, especially if they're from a different lineage within Omicron.
One of the evidences from Albert Bourla, chairman of Pfizer. He acknowledged his reinfection on Twitter after receiving 4 doses of vaccine from his company. From Delta to Omicron, scientists here in China continue stepping up their efforts to develop vaccines. After the initial outbreak, China immediately shared the first completely genome sequence of the novel coronavirus with the WHO and began research and development of vaccines. So far, 13 COVID-19 vaccines developed in China via different technical routes have received conditional market approval or been green-lighted for emergency use. 3 have been approved by the WHO and are on its emergency use list, together with those from pharmaceutical giants such as Pfizer, AstraZeneca, and Moderna. China has also been developing vaccines for easier drug delivery.
好，憋住5秒。
那你今天接种的这个感受是怎么样的？
这个吸入我感觉非常的方便，然后其次呢，我事先了解到这种疫苗能激发我的黏膜免疫，抗体的水平更高，能更好的保护我们。
以前是脱衣服打针，特别不方便，现在稀释多方便呢，一会儿完了。
China has withstood multiple COVID-19 waves in the past 3 years with the aid of massive vaccination drives. The latest data shows that the rate of COVID-19 full vaccination exceeds 90% of the population, forming an effective defensive wall against the rapidly mutating virus. By December of 2022, China's annual COVID-19 vaccine production capacity has already reached 7 billion doses, and about 3.45 billion vaccine jabs had been administered. More than 228 million people above 60 had been given full inoculation, accounting for over 86% of the total population in that age.
中国的疫苗
WHO research shows that 3 doses of inactivated vaccine and 3 doses of the Pfizer mRNA vaccine offer basically equivalent protection against severe or fatal outcomes among adults aged 60 years or older.
On January 8, 2023, China redefined COVID-19 as a Class B infectious disease, down from Class A, making the opening of a new phase in its COVID-19 response. The transition was made possibly by the country's scientists who developed a range of COVID-19 vaccines, the manufacturers who produced billions of doses of them, and the medical workers who administered them. China's development, production, and application of vaccines not only continue to help its own population, but also contribute to the global fight against the disease. That's how leaders from over 20 countries around the world reacted to China's vaccines with action.
接种中国的疫苗
More than 100 countries and international organizations have received about 1.2 billion doses of China-provided vaccines, which has proved their efficacy and contribution to the fight against COVID.
China's provision of safe, affordable vaccines to the countries in need is a telling demonstration of its sense of responsibility.
COVID-19 vaccine development and deployment in China, when available, will be made a global public good.
This has been China's contribution to ensuring vaccine accessibility and affordability in developing countries. Chinese vaccines have been proved to offer the same protection against critical illness and death as foreign vaccines, despite all vaccines giving no guarantee to prevent a spread for Omicron globally. For China, COVID vaccines are not an income generator, but a global public good. The country says it will continue to provide vaccine aid for countries in need and cooperate with the international community.